Taylor, and when creating this patient's intervention program, I would want to keep in mind her goals of returning to running and playing basketball, and also being able to go through full dorsiflexion range of motion without pain when she's descending stairs. So to start, I would get her warming up. At first, I'd get her warming up on the bike, and then eventually I would want to progress her to treadmill intervals where she's walking for like 30 seconds and running for 30 seconds. This would be using the SAID principle, being specific to her goals. So I would start with some ankle mobs, doing some AP glides on her ankle to get it loosened up so that while we're doing the exercises, she will have better flexibility in her ankle. So then I would target her hips by doing some bridges on the mat or on the table to strengthen her hip extensors. I would even add a band to help activate her hip abductors as well. Then I would move her to standing exercises. So we're going to do some standing dorsiflexion marches to help increase her dorsiflexion strength. And I do about 3 sets of 10, low sets, high reps for muscular endurance. And then we would move on to the elevated heel raises. So with her heels on the wedge, toes down, because she can do partial range of motion in the heel raises, we're going to target her at end range. So doing some heel raises at end range. Then to improve her balance, I would do a 3D ankle excursion exercise where she's standing on her right leg and she's having to balance while reaching forward, back, to the side, and in all the planes of motion, so that she has to stabilize during and balance more dynamically. Eventually, when she was ready, I would progress her to step downs with the heel tap, because this would also target her hip strength as well, as she's having to lower herself down and tap. So this will help increase dorsiflexion and strengthen her hip as well, which would be specific towards her goal of being able to descend stairs without pain.